So I hope to give an overview in terms of an introduction to actually what many of the other speakers this morning are going to be talking about in terms of where we are currently with autism research. So the challenge we have with autism is that, as all of us know, it's quite a spectrum. It's quite a spectrum in so many dimensions. It's a spectrum along an age continuum, across a gender continuum, as we've heard about, across some disabilities that come in many different areas, whether they be cognitive issues, behavioral issues, attentional issues, and yet we use the umbrella term autism to include all of this. And hence, a lot of the challenge that we have, both in terms of understanding the condition, in terms of supporting individuals, really comes because we're not really trying to support one person or one disorder. We're really talking about, I think, probably hundreds of conditions along this spectrum. Also, as we think about it, I would argue that autism is not simply a dichotomous diagnosis. That is, that it's not simply either yay or nay, someone has or does not have autism, but in fact, it's a continuum. So if, for instance, we were talking about diabetes and blood sugar, there's a continuum. If you happen to be above 125, then we officially say you have diabetes. In the same way, I would argue that when we talk about the continuum for many of the behavioral features associated with autism, we're also talking about a continuum. And it's really, in some ways, for convenience that we say someone is over a threshold and therefore has the diagnosis. But in fact, I think there's a lot we can learn actually from all of us in terms of behavior and the way our brains are working to inform what we're doing for families and individuals with autism. As I said, and what's interesting is along this continuum, there are differences that are really quite different, even around the world. So differences in terms of culture, cultural norms, what's acceptable, how people are raised, cultural norms for gender gaps, differences between girls and boys, and in fact, how we raise children and what effects that might have ultimately, as well as the challenges that individuals with autism have that really make each individual unique. Issues that might have to do with anxiety, issues with attention, issues with auditory processing, sensory issues, each of these in the unique combination of features that any one individual will have at any one point in their life manifest as what we're calling autism, but really each person is unique. And again, along their life course have unique features and unique things that come with that as they're aging and as they're developing. So as we're doing this, we call this umbrella term autism, but I would actually argue that we need to be much more precise. We need to be much more individualized, both in terms of how we define what those challenges are, and more importantly, how we understand how the brain is working to ultimately come up with better ways of supporting those individuals. The problem we've had with a lot of autism research, and I'm not calling anyone out to blame them, it's simply been a matter of what we were able to do, but much of it's been limited by the small sample sizes that we've had, and in a way, it's like drawing randomly certain number of small individuals out of a hat that are really quite heterogeneous as we've done that. And so whether we've done behavioral studies, whether we've done imaging studies, or whether we've done intervention studies, quite honestly, if we've seen something, it's almost by luck, because as we've done this, there's a real sampling error that we can have. And it's led to problems that we've had in terms of reproducibility in the field, being able to reproduce each other's work, because in part, we were taking different individuals who were in different places along that spectrum. As a result of that, one of the things we're working very hard at the foundation to do is to try and do things that will catalyze the field, being able to allow us to be more robust, more rigorous in the studies that we're doing. And I'll get to this in a little bit more. As we're doing this, we do want to be able to have a more homogeneous cohort that we're looking at. So for whatever studies these are, be able to at least define individuals, whether it's along the phenotypic measures to make sure they're more homogeneous in terms of their behavioral differences, or along things like the genetic spectrum, or whatever those other biomarkers might be. But again, to try and define the subset that we're studying and then see if we can reproduce some of these studies in those individuals. And as we do this, we really need to, in my opinion, make autism what we've done for childhood cancers. Every patient, for instance, that in our institution is seen with a pediatric cancer is in part of research. And I would hope that we can get to the point that every individual with autism can contribute to the answers that we need for the future by being part of that research as well. One of the things that we've created recently that Allison mentioned is the Simons Foundation Powering Autism Research for Knowledge. So trying to be able to get now a community of individuals together who want to participate, but make it as easy for them as possible to be part of this movement that we need to move forward. In doing this, much as Allison was saying, we've made this easy. You can give us bit, whether it's for the Sisters Project or for Spark, but by being able to make this as a resource for the community. So for you as researchers to make your jobs easier so you don't have to worry so much about recruitment for your studies, you've got a cohort of 50,000 or more individuals who are ready, willing, and able to be able to participate in your research studies, who are well characterized, both genetically as well as behaviorally, to be able to know if they fit your eligibility criteria for this. As we do this, one of the conundrums that Allison already mentioned is the difference that we have between males and females with autism. And that's still one of the greatest insights potentially that we can get in terms of thinking about how we might be able to support individuals better. I truly don't know the answer, but we may hear some of the answers later today in terms of what those differences are. Are some of those differences cultural differences? Are some of them in terms of how girls are raised? I'll put something provocative out there. Is it who's evaluating and who's deciding what the norms are? I have to tell you that within the field, we have more women that are in the field, and maybe we have different expectations, and so maybe that's part of the difference as well. There are differences in terms of externalizing versus internalizing behaviors, and so maybe it's what we're literally seeing as a manifestation outwardly of these behaviors, but who knows what's going on that we're not akin to or not privy to. So with this, I would argue there are many dimensions and we haven't figured these all out. Ultimately, if we want to be able to get to minimize the burden, part of this is actually decreasing, if we knew the cause, is decreasing those exposures. We don't know all of those exposures for sure. Certainly, they are likely to start even prenatally. So for mothers in the prenatal space, whether these infections that they could be exposed to, environmental toxins, but other things that are affecting the developing brain, either before delivery or in the first couple years after delivery. Certainly, these are very hard studies to perform epidemiologically. But again, we're trying to get to cohorts around the world, wherever they are, to have big data to inform us and to get access to the samples that we need to be able to answer and address these questions. We've certainly had a longstanding belief that genetics is certainly not the only answer to autism, but it does give us some very well-validated targets that we can be able to go after in terms of developing new insights to how the brain works, as well as new treatments. We certainly know that at least in some individuals, there is a strong genetic component, even dare I say, a single gene that might be causing autism. In other individuals, it's more complicated. It's probably a collection of several different genes, and in probably the most common circumstance, not just the genes, but certainly the genes as well as the brain's exposure and the ability to be able to intervene with the appropriate therapies, especially in early childhood development. And so with this, again, what we're trying to do with Spark is to realize that, for instance, through the Simplex Collection, we've now identified approximately 50 genes that I consider well-validated genes for autism, but this is just the tip of the iceberg. Estimates are that there are probably at least 500 of these genes, and we do need to increase the sample size, and that was part of the reason as well for starting Spark, to be able to come up with now a national, in the United States, cohort that was available for the long run, a commitment in the long term to be able to support and engage these families, again, at least 50,000 of them, so that no matter where you're doing your research, we can help your research to be more effective, more powerful, and more diverse. Trying to especially get to individuals who previously weren't able to participate in research, whatever those barriers were, whether it be language, whether it be geography, whether it be socioeconomic status, to make sure that we can represent everyone in the communities that we're trying to address with this. Oops. As we're doing this, one of the things we very much are committed to is making this a very new way of doing research, being able to actually reciprocally work with the researchers, with the participants in the community, getting their ideas. What are their challenges? What are the biggest obstacles they're facing? What are their priorities? Because their priorities need to be what our priorities are in terms of doing this. As we're doing this, we want to actually give something back to them. This is not simply a one-way street for researchers. This is a two-way dialogue and communication. And so even at the very root of it, giving individuals back information about the genetic information we might learn from them, from their psychological evaluations they're doing online as we're characterizing them, giving that information back to them individually, as well as seeing what the entire group of us is learning together, I hope is a new way that we're thinking about doing research in the future. We're getting there. We're not quite there yet in terms of the genetics, but we are getting there. At this point, I would say that based on our most expansive analyses that we do, we can probably now account for about 25% of individuals who have autism based on underlying genetic factors. But that's certainly not the only answer, and we still have a long way to go in terms of identifying all of those factors. We do know that in women or in girls, at least for those that are at the more severely impaired end of the spectrum, as well as just across the board, there is more likely to be a genetic cause. Whatever that liability, that protective factor is, at least some strong, powerful genes in those individuals are more likely to cause autism in those individuals. And as we've done this, we've now started to do studies, as Allison mentioned, with Simon's VIP, to now characterize very well-defined genetic forms of autism. Each one of these is individually rare, but collectively common. And as we've done this, I've had the pleasure of working with John Spiro in particular with our Simon's VIP program over several years. Again, we've tried to make this now as a way of being able to get very deep phenotyping. And just to say, it's complicated. When we first started doing this, we thought when we identified an autism gene, everyone with that gene would have autism. And boy, were we wrong. We realized that this is actually a continuum, that these are all genes that affect the way the brain works, the way the brain develops, the way the brain behaves. But on the other hand, there's not just a strict autism. Individuals have this other overlapping set of features, problems with attention, problems with speech, other behavioral issues, and they overlap. And sometimes someone crosses the threshold and has an official diagnosis of autism, but in all cases, these individuals have some of these challenges. We've seen in this one particular group of 16p11.2, one particular copy number variant change that we see even differences in terms of basic brain architecture or functioning with handedness, whether or not someone's right-handed or whether someone's ambidextrous. We've seen things with brain in terms of globally differences in brain volumes, and in some cases we see with certain genetic forms even very particular parts of the brain that are structured and developed individually differently. And as we're doing this, we realize that the overlap is not even just with the way the brain's working with autism or with some of these other challenges, but related to other conditions like schizophrenia, and even the way other parts of the body are working in terms of epilepsy and other phenotypes of that, or even things like the way the heart is working or with other birth defects. But as we're looking towards this, I'm incredibly excited because I think now, as in no time in history, we have technologies that will be able to help us to be able to support individuals better. Things that we can do with big data. We have big data like we've never seen before, medical records now of 60 million plus individuals that are put together to be able to address and answer these questions. Big data in terms of technologies who can help identify individuals very early in life who may be at risk for autism, as well as technologies that can help individuals to be able to support them, coach them, be their best in what they're doing. And as we do this, I hope we'll get to the point of clinical trials. And clinical trials, I don't mean just medications, but certainly one point of this in identifying all of these targets or to develop more targeted medications. We're going to steal from the oncologist in some cases with genes that have been identified in cancer and some of the drugs they've been developing for that to treat this, as well as being able to have better study designs and better outcome measures that will truly help us know whether or not we've reached our goal and reached our target as we're doing this. So thank you for having me here today. Just to say that I have the pleasure of working with a fantastic team at the Simons Foundation, and they're the ones who really deserve the credit. So I'll be glad to stop here for questions.